Good morning. So, in continuation to our previous class, where we have told that there is a different mechanisms are involved in the drug transportation across the membrane. So, we'll see one by one about those transportation mechanisms. Now, first one is the passive diffusion. Now, passive diffusion, it is known as a non-ionic diffusion. They are non-ionic diffusion. First important point. Next is it is the concentration or electrochemical gradient, or also it is known as a downhill transport. Now, what does it mean? It means the transportation of the drug across the membrane, it is for the concentration base. That means high concentration to low concentration. Clear? High concentration to low concentration. Drug movement across the membrane from the higher concentration to lower concentration. As it is going from the higher to lower, that's why it is also known as a downhill transport. Clear? Downhill transport or electrochemical gradation, because again for the concentration, because it is depends the movement, it is depends upon the higher concentration to lower concentration. Almost 90% of the drug, clear? What are the different 90% of the drug follow this particular process of the drug absorption. Clear? Drug absorption. Now, according to the fixed first law of the diffusion, because in the passive diffusion it follows fixed first law of the diffusion. Now, what is meant by the fixed first law of diffusion? In the fixed first law of the diffusion, we are getting this equation where the dq by dt, dq by dt is rate of drug diffusion, rate, amount by time, rate of the drug diffusion. So it is also represent the rate of appearance of the drug in the blood. So of course you can say that in which rate the drug is diffused across the membrane. So that is we are denoted by the dq by dt. Next is dA km by w divided by h into Cgit minus C. Now D means diffusion coefficient. It is the diffusion coefficient of the drug through membrane. It is again by the area by time. Diffusion coefficient of the drug through the membrane. So this is we are getting as the area by time. Next is A, surface area. Surface area of the absorbing membrane of the diffusion. Surface area of the absorbing membrane of diffusion, that is the area. That is the area. Next is km by w. Km by w is the partition coefficient. Partition coefficient of the drug between the lipoidal membrane and aqueous GIT fluid. Partition coefficient of drug between lipoidal membrane and aqueous, you can say that GI fluid. What does it mean? It is the partition coefficient between the lipid and aqueous. Lipid and aqueous, because membrane is the lipophilic in nature, already we have told. Now CGIT means concentration of the drug GIT. If we are considering, if you are administered the drug through the oral route, so what is the concentration of the drug into the GIT? And C means concentration of the drug into the plasma. Let's concentration of into the drug into the plasma. So that is the difference. CGIT minus C. Concentration of the drug into the GI fluid and concentration of the drug into the plasma. H is thickness of the membrane. Thickness of the membrane. Now from this what we can say that if D is more, then rate of the diffusion is more. If surface area is more, surface area means A, then you can say that the rate of diffusion it will be more. If km by w, that is partition coefficient of the drug, is more, that means if it is more lipid soluble the drug, the you can say that rate of diffusion it will be more. CGIT minus C, the difference into the concentration, if it is, you can say that more, then you can say that the drug it will move more. And H, but if the thickness of the membrane is more, then the rate of diffusion it will be delayed. And molecular weight, the drug having the molecular weight 100 to 400 Dalton, it is you can say that transported through this process. Of course exception is there, cyclosporine, which is almost 1200. And sink condition, what does it mean by the sink condition? Now say in the normally this particular, whenever we are talking about the higher concentration to lower concentration, until what this type of the movement it will continue until the both the sides it will reach to the equilibrium. For example, this is the high and this is the low, so the drug movement is higher to lower. So once the equilibrium reach, the transportation it will you can say that stop. But actually theoretically it's possible, but practically it is not possible. Why? Whenever the drug it is present into the GIT and after that it will absorb into the systemic circulation. But after absorbing into the circulation, it will be distributed into the different body compartment or the protein, which already we have discussed. So actually in the systemic circulation, it is always less than the drug present into the GIT. As a result, all the drug it will, you can say that, absorbed through the membrane. So this particular situation it is known as a sink condition. Now port transport, what is mean by the port transport? Port transport, you can say that it depends on port transport, those molecular weight is less than 100. They are transported by the port transport. It is also known as a connective transport, bulk flow or the filtration. And generally water, urea, these are the, you can say that, substances are transported via this port transport. That means if you remember that in previous part we have discussed about the biological membrane, and there is a water filled pores, clear, water filled pores, small water filled pores. So water filled pores, you can say that drugs which is soluble in the water and their molecular weight is less, or the substance which is soluble in water and molecular weight is less, they can be easily transported through this port. And this is, you can say that, rate of absorption via port transport, that is dc by dt, rate of absorption. S is the number of the port, r is the radius of the port, then a dot ac, again you can say that surface area, then ac is the concentration gradient, h is the thickness, already you have told, and you can say that the viscosity of the fluid in the process also it is important. Now coming to the felicitated diffusion and active diffusion. Now both the cases, both this type of the things, it is nothing but the carrier mediated transport, clear, carrier mediated transport process. Why the carrier mediated? Because they required a carrier, clear, they required a carrier. Now in this particular process, if you see about that, this is a, for example, drug molecule. The drug molecule it will bind to the carrier. It will bind to the carrier. After binding, both the cases, after binding the carrier, with the carrier it will transported through the membrane, and after the transportation there will be the dissociation. Clear? There will be the dissociation. Here what will happen? Both the cases, dissociation and the drug it will be free. The drug or the substance it will be free. Now what is the difference? Now this is actually concentration gradient, that means higher concentration to lower concentration. Felicitated concentration is the higher to lower, but active absorption is the lower concentration to higher concentration. So lower concentration to higher concentration. So this is also a type of downhill transport, but this is active transport. It is the uphill transport process. Clear? Uphill transport process. Next is in you can say that felicitated diffusion. It do not require the energy because it is the concentration gradient, higher concentration to lower concentration. But in case of the active, they require the energy because this is the lower to higher. Clear? Lower to so higher to means the drug transportation is low to high. That means lower to higher. That's why they require the energy. But both the cases they require the carrier. So this is the difference between the felicitated diffusion and active diffusion. Both are the carrier mediated transport. Carrier mediated transport, and the transportation it will depends upon the number of the carriers or the free carriers present. Next one is the ionic or the electrochemical diffusion. This is the charge influence of the permeation of the drug. Clear? The charge is important. Molecular form of the solute are unaffected by the membrane charge and permeates faster than the ionic form. So that will, as we have told, that in the given pH, unionized molecule, it will be absorbed first. Clear? Unionized molecule, it will be absorbed first, then the anions, then the cations. So by that way, this is the rate of the diffusion. Unionized molecule, it will be first, anions and cations. But of course, for the anions and cations, it will be influenced by the pH. You can say the transportation, it will be influenced by the pH. Ion pair, in that case, what will happen? Cations, it will be bind to the endogenous substance, like that of the carrier mediated. The cations, it will bind to the endogenous substances which is anion in nature. So positive and negative is there, so they will form a neutral molecule, neutral complex. Clear? Neutral complex. After this neutral complex, it will pass through the membrane using the passive diffusion. Here they will form the complex and they will pass through the membrane, the passive diffusion, and again they will be isolating as a free drug and the carrier. So endogenous anion, it will act as a carrier. So this is the ion pair transport. Next one is the endocytosis. Now endocytosis means it is nothing but the cell eating or cell drinking. What happened? The macromolecules is there, it will come near to the membrane, and the membrane, it will engulf the molecule. The molecule is engulfed by the membrane, and after engulfing, it will you can say that vesicles, it will the molecule, it will be there under the vesicles, and in that condition they will cross the membrane, and then after inside the cell, that means into the blood, it will be again you can say that thrown out by the membrane. So by that way, you can say that by that way, the drug or the molecule, it will transporting through the membrane. So that is known as the endocytosis. It is the process of the engulfing. So if it is the solid in nature, then it is known as the phagocytosis. Clear? Phagocytosis. If it is liquid in nature, it is known as the spinocytosis. Clear? Thank you. So this is about the process.